couple of unshaven professionals here on TV. Jack Roper here with No Shave November underway. And Dr. Freed, how are you, sir?
Doing fine, thank you.
You're an oncologist, radiology oncologist.
That's right.
Did I say that right?
Radiation oncologist is how we like to say it.
Just didn't flow off my tongue, but I got you. You're with the Gibbs Cancer Center in Spartanburg, and welcome. You quit shaving, and we want people to ask us about our beards because we say what to them?
Well, we say that this is to help raise awareness for men's health issues, primarily men's cancer issues.
Yes.
Prostate cancer being one of those.
Is it true if you live long enough and you're a man, you're going to get prostate cancer? Is that true?
It is fairly true to say that. In fact, studies have shown from autopsy series that if you take a man's age, subtract 10, that's about the chance he has of having some cancer in his prostate, though for most of those men, they'll never have cancer that becomes clinically meaningful.
Yes, okay, but that's kind of frightening, but it is curable. I mean, there are treatment options. I know I get the prostate checked once a year, I think, with my doctor. And what do you recommend as far as staying on top of that possible?
So there's actually a fair amount of controversy about that right now.
Right.
A group called the U.S. Preventive Services Task Force, which is a government body that is charged with telling us what should we get screened for. They've come out really not favoring PSA screening, although
that's a blood test.
That's a blood test to look for a protein that's made both by normal prostate and by prostate cancer. But the American Urological Association and the American Cancer Society suggest that you start thinking about having your PSA checked at age 50 for men who have a family history of prostate cancer, or for African American men, they should start thinking about that at age 45 and have a discussion with their doctor about that.
So there's a higher rate with African Americans?
That's correct.
Prostate cancer. And the tried and true test is actually, I call it the finger wave in lieu of a better term, but that's actually going up in there and checking it, feeling it.
Yeah, so the finger wave is somewhat helpful, though it only really detects cancers that are right on the back part of the prostate and that are making nodules.
Okay.
So a lot of cancers really aren't in that location or large enough to be discerned that way. So we don't always find that that's accurate for us.
But now, other than removal, there are some other options as far as treatment if you indeed are diagnosed with cancer?
That's correct. So I'm a radiation oncologist, so I know a lot about the radiation treatments for prostate cancer. There are a few ways that we can do that. One of those is with a traditional course of 9 weeks of daily radiation, once a day, Monday through Friday.
Right.
But now for low-risk prostate cancers, we actually have a 5-treatment regimen that we are able to provide for our patients, especially now that we'll have a new machine called a CyberKnife available as part of the Gibbs Cancer Center.
Well, tell me more about that. That's new.
Right, so the CyberKnife is just being put in now, and it is a robotic radiation machine that allows us to treat very precisely to very high dose to small regions within the body.
How does prostate cancer in men rate as far as other men's cancers?
So it is the most commonly diagnosed cancer in men, about 230,000 men diagnosed with the cancer every year in this country. And it's the second leading cause of cancer death in men in this country. About 30,000 deaths, second to lung cancer and just above colorectal cancer.
Wow, right in the middle of those two. And those are two that get more attention, I think.
Right.
More publicity. So that's why we grew a beard.
Exactly right.
Right. Does your wife hate it like mine?
Yeah, my kids hate it even more.
Okay. Yeah, I get no more kisses from your wife. But again, we want you as a man or the wife of a guy to insist on perhaps approaching your doctor about finding out about prostate cancer.
I think that's exactly right.
Doc, thanks for coming. I appreciate
Absolutely.
it very much.
Glad to do it.
Get that thing shaved off December 1st.
I'm going to.
I've been told to do that.